management for the ADHD, there's no precise type of management, but the goal is to keep the client activities moderately and somehow relax the client so that the hyperactivity will not overflow. So the type of exercise the client can do is aerobic exercise, because here the heart gets pounding, and if the heart races, it keeps there's a set amount of time, like half an hour, to do the activity. So the aerobic exercise creates new pathway in the brain and floods it with the chemicals that helps to pay attention. So you can have running or walking briskly, or biking and swimming by laps. So it could be performed by adults and children. So do activities outdoor or indoors, but preferably outdoors is more advisable because it can reduce the symptoms of ADHD. And when exercise is done outside, the environment somehow could help the client be calm. So you can also do martial arts like jiu-jitsu or karate or taekwondo, because some experts mention that the complex exercise is better for the brain, and that it could increase self-control and bringing together the mind and body. So there is a focus in concentration, balance, timing, memory, consequences of action, and fine motor skills. So other complex exercises that can be done is rock climbing, dance, gymnastics, and yoga. So for the strength training, if only the patient is just started, we can advise aerobic activities like walking or jogging first, then lunges, squats, pull-ups or push-ups, then weightlifting. So for the team sports, it is good also for the client to be mingling with other children or other people. So if the client can join football or soccer league, it may be just the thing to get up and moving several times a week. So you can organize sports activities that is beneficial for physical exercise with the social group to motivate the client. So teamwork hones communication skills and help think through actions and plan ahead. So as part of the team, it can also improve self-esteem. So how can we help the client keep doing the activities? First, we will have the activities interesting. We can switch the type of exercise according to the interest of the client. Second, we can find partner, or if ever we can be a partner to our client for such sports or activity, it is good also. So move in the morning. So it is if there's no problem with the schedule, so a good exercise first thing in the morning is refreshing for the client to freshen up the mind before taking the medication. And also that way the client will have a good mood boosting chemicals in the body. So maintenance of the medication should not be forgotten. So exercise also can help with the ADHD symptoms, but it doesn't replace the medication. So don't stop the treatments unless the doctor approves if the medications could be stopped. So that is for the medical management. For the medication with children with ADHD, the doctors will give stimulants, and it is usually started with low dose of amphetamine, such as Adderall XR, and Dexatrine. There are also two stimulants given, like methylphenidate, an active ingredient for Ritalin, Concerta, and other formulations, and the second type is the amphetamine, which is present in Adderall and Vivancy. So the list of those medications are like Adderall XR, amphetamine, it belongs to amphetamine, Concerta, methylphenidate, Evekio is also amphetamine, Fucalin XR and Relevant XR are those like methylphenidate, as well as Ritalin, and Strattera is like hydrochloride, and Vivancy is dimethylate. So for adults, it's just the same medication, but it is a long-lasting medication, as we all know that adults have different schedules than children. So the medication will last up to 10 to 14 hours. Those medications like Adderall XR, Concerta, Daytrenia, Fucalin XR, and Vivancy. And there's also a medication given for adults with ADHD and together with anxiety. So the doctors will somehow prescribe bupropion, lisipramine, impripamine, nortriptyline, and venlafaxine.